On today's episode, we're going to be talking about a really interesting and complex sleep disorder called sexsomnia. If you have either experienced it yourself or been the partner of someone who has experienced it, this episode is going to be for you. I'm Jay, and this is Somnilopod. Hello, everybody. Welcome back. I am so glad that you decided to join me today. I am just getting back from a vacation myself. I went with my siblings up to the Lake Huron, the north part of Michigan, and had a wonderful time. So now I'm ready to hit the ground running and do several episodes. And the episode we've got today, the topic we've got, is one that the 13-year-old boy that lives in the back of my head always wants to chuckle about whenever I read or talk about it. But we're going to ask him to take a back seat today because the disorder that we're discussing is called sexsomnia. Now, it's a disorder that is characterized by engaging in sexual behaviors while asleep. You can imagine the unique challenges it poses for individuals and their partners. Coping with sexsomnia requires understanding the nature of the disorder and implementing strategies to manage the symptoms, as well as fostering open communication support within the relationship. This disorder is also known as sleep-related abnormal sexual behavior, or sleep sex, and it falls under a broader category of what we call parasomnias. And these are the really odd things that happen in the sleep world. Things like sleepwalking, sleep talking, bizarre movement disorders, things like that. They are abnormal behaviors or experiences that always occur during sleep. Now, unlike voluntary actions or conscious decisions, sexsomnia involves involuntary sexual behavior. It can be things like fondling, masturbation, intercourse, initiated all during non-rapid movement sleep, non-rapid eye movement sleep. That's non-REM sleep, and it's an important distinction because they're not acting out a dream sequence because it is occurring in non-REM sleep, and the majority of our dreaming occurs in REM sleep. There are some disorders that do occur during REM sleep that are the acting out of dream scenarios. But this falls within the non-REM sleep that we all have during the night. So it's a different type of disorder altogether. These behaviors often occur without the individual's awareness, and you can imagine it can lead to distress and embarrassment and interpersonal conflicts. And I have some experience with this myself, which I'll talk about here in just a little bit. Some of the things that need to be recognized and need to be done when sexsomnia is recognized as a potential for what's happening. Always seek professional evaluation. Individuals experiencing sexsomnia should undergo a comprehensive evaluation by a sleep specialist or a healthcare provider with expertise in sleep disorders. A thorough assessment can help identify underlying contributing factors, such as things that disrupt sleep. And one of the things about parasomnias is that often we see that disrupted sleep can help trigger these events. So disorders like sleep apnea, restless leg syndrome, and other things that disrupt sleep need to be evaluated for and treated so that the patient or the physician can make an informed, tailored treatment recommendation. And since maintaining sleep is so important for people with parasomnias, establishing good sleep hygiene is always going to be important. Good sleep routines, relaxing sleep environment, relaxation techniques, things that we have discussed many times in the past to help maintain your nighttime sleep and to make it as deep and as consistent as possible. Now, in order to help facilitate that, sometimes pharmacological options are necessary. And in some cases, things like SSRIs or benzodiazepines or low-dose sedative hypnotics may be prescribed to help keep the person asleep and help reduce those events of sexsomnia throughout the night. And it's also important to remember that this is a movement behavior, regardless of the type of behavior. It is a movement behavior, so there is risk involved. Individuals affected by sexsomnia should take proactive steps to ensure their safety and the safety of their partners during sleep. This may involve using a physical barrier, such as separate sleeping arrangements. It's not necessarily a sleep divorce, but it is something that could be looked at and maintained in order to help prevent some uncomfortable situations. And speaking of uncomfortable, not only is it uncomfortable for the individuals that are experiencing the behavior because they have no conscious control over what is happening, but it can also be uncomfortable for their partners. And this is where I have some experience. I had a partner that had sexsomnia, and we didn't really recognize that was what it was. One of the things that it's really important to recognize when you have something like this occur in your relationship is that you need to be open and talk about it. Open communication is going to be something that is really the first step toward creating not only a safe place for dialogue, but just to help gain some understanding. I will say that this is something that I failed at. I was not very compassionate. My typical, there's that 13-year-old boy again. He's rearing his ugly head. But my typical response was, "Get the hell off me, I'm trying to sleep." Sleep is important to me. It always has been. I could have been much more compassionate about the situation, but I wasn't. Some other things other than open and honest dialogue would be to establish some specific boundaries, to set clear expectations about when these episodes occur. Sometimes there can even be a specific signal, like a safe word, for example, so that the partner recognizes that this isn't one of those episodes of sexsomnia. This isn't an involuntary thing. It's just part of their relationship. If the couples are not able to address some of these things on their own, couples therapy may be necessary. Counseling can help to provide that environment for partners to really explore and to discuss and to implement strategies in order to be able to take care of the situation and to address the parasomnia. And again, I need to point out, it is a parasomnia. It is not something that they have conscious control over. So, of course, hindsight being 2020, I recognize that was something that I failed to do in the past. So, if you find yourself in this situation, or if you and your partner discover that one or the other of you is initiating behavior at night that is not necessarily kosher, talk about it. Seek professional intervention. There are things that can be done and strategies, as we discussed earlier, that can be implemented to try to minimize the disruption to your relationship and to help create that collaborative and supportive environment that people who suffer from any sort of illness or disorder really need in order to have a fulfilling and harmonious relationship despite its challenges. I hope this has been interesting for you. If you have ever experienced something like this, please give me a call. Touch base with me. Send me an email. You can reach out to me at j@somnilopod.com. You can also touch base with me on Facebook and Instagram. And as always, until next time, please remember to make sleep a priority. Thanks so much.